Welcome to the Back to Health podcast, where we share inspirational stories of hope to help you reclaim your health. If you're suffering from a chronic condition and have been given little to no hope, if you've been told that there's nothing wrong with you, but you know there definitely is something wrong, or if you're just trying to be preventative and want to know how to reclaim your health, then this podcast is for you. I can't wait to share today's episode. Hi everyone, and welcome to the Back to Health podcast. Today is my first episode with a guest, and I'm really excited to introduce him to you. So Ian is a serial entrepreneur and socially responsible business person who believes in business as a means for doing good. He markets products that are good for people and the planet. And while the world has changed and we have evolved, what has remained constant is his desire to use business as a way to do good and make the world a better, more livable place. Now, today, Ian's here to share his story of how he overcame Crohn's disease, going against the advice of his GI surgeon. Now, while this podcast is not giving any medical advice, and I always urge you to consult your general practitioner wherever you have concerns, this podcast is here to give hope and inspiration to those who want an alternative route to be able to heal their health conditions naturally and holistically. So I'm so excited to welcome Ian and see how his story inspires us today. So Ian, thank you so much for making time for the Back to Health podcast and for our audience. And I'm sure there is so much wealth to share. When I read your story, I was inspired by both the thought process that you were going through when it came to dealing with your health condition, and then also the more the medical side, the way that you describe the condition and the symptoms and sort of what people might look out for. So I guess for those not familiar with Crohn's disease, maybe you could give us a bit of a description of sort of the symptoms that you were experiencing and how you sort of came to understand that you had Crohn's disease in the first place.
So I was pretty ignorant, I think, for a long time. I believe I had Crohn's disease and didn't understand that I had Crohn's disease. So occasionally I would have diarrhea, for example, and then whenever that happened, I would just increase my amount of probiotics that I took that day until it went away. And so I was fairly well able to control the Crohn's. It was the kind of thing where my wife loves to walk in the morning, and I just knew that's not something I want to do with her, because invariably, if I went for a walk in the morning, I wouldn't be able to finish the walk because I'd have to find a bathroom. And I just thought, well, that's just the way my composition is. And then in 2017, I had a very bad burn, and it took about a year to recover from that. And so my focus was on the burn, and I had terrible pain, and I was taking ibuprofen like it was candy. And I didn't understand it at the time that the ibuprofen was contributing to the inflammation.
Yeah.
So I ended up having what's called a fistula, which I call a pain in the butt. It was just very, very painful. And I went to a local health clinic, and they said, well, you have hemorrhoids, and take this steroid cream, and within a month you should be fine. Well, I took it for a month and I wasn't fine. And and then they also discovered that I had blood in my stool, and they suggested that I have a colonoscopy. At that point, it was very painful for me to lie on my left side, which was where my burn had been. And so I wanted to see a GI doctor about my hemorrhoids, but I couldn't get an appointment. So eventually I decided, okay, they're going to put me out for this colonoscopy test. And so I went ahead and did that. And it was at that time that I discovered that I had what they called moderate to severe Crohn's disease and a perianal fistula. And they were not very hopeful, let's put it that way. They were telling me that I was very, very ill. Go ahead.
And when you went to have that sort of the colonoscopy done, sort of where were you before getting the diagnosis in terms of how bad or how serious you thought the situation might be at that point?
Well, in some ways, I was ignorant because I was focused so much on healing my
The burn.
burn, and so that was a major undertaking. Uh, they they tried to put the fear of God in me. I think they
Yeah.
really played on my fears and told me that I'd have to take a very, very expensive biologic prescription for the rest of my life. Every
Yeah.
6 weeks and then every 3 months. And I just left this doctor's office so feeling so low and depressed and thinking, how did it come to this? First, I had this very bad burn, and then my health had declined, and the doctor saying to me, "You need to see a cardiologist because there's a risk of problems with your heart with this medicine. You need to see a dermatologist because there's a chance of skin cancer. You need to take all kinds of to get a flu shot and various things of the like because your immune system's going to be suppressed." And I thought, this this is not what I want to do. This is not what I believe in. And I just felt like my life was so out of control, and I couldn't imagine doing that. And it seemed like that was such an extreme for the initial way to treat this. I thought, there's got to be a better alternative than this. Uh, why would I want to spend $100,000 on a prescription that's going to totally has horrible risk with it? Why would I do that as an
I'm going
initial
to
step? Go ahead.
Yeah, and going to give you worse diseases than the one that you're actually trying to cure. So knowing that it could result in cancer, knowing that it may result in cardiac issues, they're still recommending something which can lead to further problems, knowing that there could be further problems. And I find this is the really confusing thing with diagnosis. It's like you have this issue and this is your route, but it will lead to worse, and you sort of feel really powerless in that situation. And I've been in a similar situation for family members of mine where I've had to make a medical decision on their behalf. And it's either you stay as you are or you have this treatment and you know that this may resolve, but you'll be left with other conditions which will definitely impose on your quality of life. So it's not really a decision or a choice, which is one of the reasons I got into holistic and natural medicine in the first place. So yeah, I'd love to hear sort of what were your next steps after this point.
So, quite for decades, I had an appreciation for homeopathy. My sister-in-law, long, long time ago, gave us a remedy kit, and then she
Yeah.
also bought a book for us, like Guide to Nutritional Healing. So I was very much into that, and I had an experience where I was when I was quite younger. I was had hypothyroidism, and I
Mhm.
was told that I would need to take a prescription drug for the rest of my life. And I figured out I took it for a year, but then I figured out how to balance my body without taking a prescription drug. So I had some experience with the idea of natural healing. Um,
Big shout out to
and
your sister-in-law, because that earlier childhood experience, I guess, is like a belief in yourself that actually I know that when I've been told I have to take something for the rest of my life, as we're often told, there is actually an alternative, and my body can heal if I give it the right nutrients or the right treatment or the right healing that it needs. So yeah, that's so interesting.
and I had been a vegan at that point for about 24 and a half years. And so I had an appreciation for diet and health. And so when the Crohn's Foundation information that I read said I have an incurable disease and diet is unrelated to it, I just didn't ring true to me. Um, so my thought was, I live in Asheville, North Carolina, and there's a lot of alternative practitioners here. And so went online and researched um, naturopaths and Crohn's disease, and I found a guy that's like maybe 3 miles from my house that had experience with um, treating people with Crohn's disease, and he was very confident that he could help me heal my Crohn's. He said, "The fistula, I've never had success helping someone with, so you really need to rely on your surgeon for that, but I'm confident I can help you with the Crohn's." So he spent probably about 2 hours initially talking to me, first we did a phone conversation for free, and then I went to his office and spent a couple hours with him. And one of the things he asked me was, "What do you have for breakfast? What do you have for lunch? What do you eat for dinner?" And the vast majority of foods that I regularly ate, and some of them were the ones that I most loved and craved,
Yeah.
were the ones that were creating difficulty with my body. And so I left his office singing because I was so happy because I knew that, I'm very disciplined. I spent 24 and a half years as a vegan. I knew I could alter my diet and
Yeah.
heal my Crohn's. I was very confident about that.
So how different was that experience to that meeting with your surgeon, that they're sort of like polar opposites and worlds apart in terms of
It
how
was
you
so
left?
different. Oh my
Yeah.
God. Not only how I left, but just the approach.
Yes.
The traditional medical doctors usually waited a long time to see them, and you usually spent very few minutes with them.
Yeah.
This fellow was intensely interested in what was going on with me. Spent a great amount deal of time speaking with me, learning about me. He he was so accessible. Like I would email him, and he would email me back on a Sunday.
Yeah.
It was such a different experience, and it was much more reasonably priced. Although insurance didn't pay for the naturopath, but
Yeah.
I think the initial visit maybe was a couple $100, and that saved me $100,000 a year for the rest of my life. Yet an insurance company won't pay for that. It's ridiculous.
Yeah, and I guess this is where patients sometimes have a bit of a struggle. It's like I can go down this route that insurance will cover, or that is in the UK we have free healthcare to a certain extent, so it's free. Versus I may have to shell out 200 to £300 or dollars to go and see a naturopath, but actually the amount of money, but also your health that you're saving in the long term, is incomparable to the amount of money that you're actually spending on the treatment. And I think sometimes when I have patients who get in contact and they're like, I would really love to do this, but right now that's a stretch or that feels a lot of money. I think what I would say is, what's the price on your health? Like how long can you afford to go down a route that is suppressive or that is going to cause other issues that eventually one day you're going to have to wake up from and say, do you know what, there must be a better way. So yeah, it's about getting there earlier rather than later. I would urge people to sort of think. So what were the next steps then? What did your naturopath advise in terms of diet? How was it partly the vegan foods or being on a vegan diet that was causing this inflammation?
In many instances, the he gave me a book to read, or he suggested I read a book. So I ordered a book called "Breaking the Vicious Cycle,"
I love
and
that
it
book.
talked
Yeah.
about the simple carbohydrate diet. And prior to reading that book, I thought, well, I could still be a vegan and do this. But once I read that book, it's like, no, I really can't. And so he recommended that I like eat organic meats, um, just have a very clean diet. But like when I went through the list of foods that I ate, like I used to make my own hummus every week, and I would put it on rice cakes, or once a
Yeah.
week I would put it on a bagel. All that was out. I would like to have soup with like Thai noodles. That was out. I couldn't have the miso and I couldn't have the noodles. I loved pasta, which I couldn't eat anymore. I loved eating bread, which I couldn't eat anymore. Um, I love tofu, which is kind of funny, I guess, but I enjoyed
Yeah.
eating tofu.
Um, but I guess in terms of the simple carbohydrate diet, for those who don't know really what it consists of, could you just give us a breakdown of what you can eat and what you must avoid on that diet?
So it's a little bit similar to a gluten-free diet, but more strict.
Yeah. So lots of
Tomatoes.
whole food, green leafy veg, colorful veg. I guess your plate's quite colorful, and then just clean organic meats, grass fed as much
Yes.
as
Yeah.
possible. Yeah.
Yeah. And then wild fish I eat too now, wild caught fish.
And
Yeah.
how long would you say it took you to adjust to that new way of eating? Because I guess that's what a lot of patients have a lot of anticipation about. I guess you were a vegan, so you were quite strict with diet anyway, but still there was an adjustment to be made, and maybe even the fact that you had to go back to meat was a little bit of a shock to the system, like a bit of a shock to the body after such a long time. So how long would you say it took to adjust to the new diet?
So, in some ways, it didn't take long at all, and in some ways, it took longer. And by that, I mean, I liked the idea of being able to uh, cook different foods. So I sort of embraced that.
Mm.
What was tricky was finding alternatives to, let's say, soy sauce, for example. So I found liquid aminos, which I use
Yeah.
instead of soy. Um, and then I started baking muffins, for example. I have a friend who's on a gluten-free diet, and she gave me a lovely recipe for almond flour muffins with zucchini, which I love. And then I add walnuts to it, and it has some honey in it. Oh yeah, so all sugar was out too, by the way. The only
Yeah.
honey is the only sweetener that I can have.
How how long before you saw improvements or you started to feel better on this new diet?
It was almost immediate, which was kind of shocking to me.
Wow.
I felt really, really good. And then I was reporting to my medical doctors how good I was feeling, and they all dismissed it. They said, "I'm sorry, you may be in remission now, but you have a really, really lethal disease, and you're gonna, if you don't take this biologic, you're gonna end up in a hospital emergency room needing emergency surgery, and I would much rather that not be the case." I mean, they were really putting the fear of God in me. It was very, very difficult. The the tricky part was that with my fistula, the naturopath said, "I want you to rely on the surgeon," and the surgeon was telling me that my fistula was worse. And what I didn't understand was that he had no appreciation or understanding of a natural healing model. And
Yeah.
he's used to the idea that we give someone this lethal drug to wipe out their immune system, and within a matter of weeks, their symptoms are gonna subside because everything's suppressed. And so what happened with me was that my fistula reddened and appeared to them to be worse because they're not used to seeing that happen.
Yeah.
So so I'm telling them I'm feeling really good, and he comes in and says, "Well, you may say you feel good, but what I'm seeing is the complete opposite. You're not doing well at all." And that was very distressing. And I contacted my naturopath, emailed him, and he said, it could be that your body's healing.
It's the
And
healing
then
response. Yeah.
yeah, and I told the surgeon that, and he was like, if this was a GI surgeon, I could believe or accept what he's saying, but not a naturopath. And nobody knows uh, butts like a GI surgeon.
Yes. Yes.
He was so arrogant. And I think really they're so threatened, which I was kind of surprised by, because this is a pretty progressive area that I live in, and I thought people would be traditional medical doctors would be more open to alternative healing and practices, but they were not at all, and they were, I think, really threatened.
Yeah, I think it sort of shakes their belief system. You know, they've built their belief and their career and everything around their particular model of how they see healing or how they see treatment should be carried out. So the fact that something could be different and is working is almost like it's outside of their window of thinking because they can't see beyond how they've been trained and all the millions of cases they've seen that have gone a certain way and all gone down the same path because you're here bringing in something new and it's almost disruptive, which can seem threatening, I guess, because yeah, I've seen the same with doctors when you sort of say, but I've read about this, or I've spoken to someone who's tried this treatment and it's worked for them, so I'd like to try this, and they're like, oh, it could work for one person, or that's probably not the full story. They probably just still had this other treatment or whatever, and their main concern is the symptom is showing up. I need to suppress it. I need to get rid of it. We need to do whatever we can to get rid of the symptom without thinking about the whole person or thinking about the longer term consequences the person may end up having to deal with. And how sort of strong were you in your conviction at that point that no, this is my healing response, or were you made to feel to question what may be happening with the naturopathic healing at that point?
Oh, I definitely question what was happening.
Yeah.
Yeah, because it's almost like you forget. I mean, in hindsight, I can say, oh, I understand the idea that uh, the way that natural healing works. That your symptoms are going to flare up in order to get better.
Yeah.
But when the surgeon, who's the expert, is telling you that you're sicker, it was, oh, I was so discouraged. I was like, I can't believe this. I'm so upset.
And I'm feeling better, so like how
Yeah,
could it be worse? Yeah.
yeah, exactly. Yeah. And then the day that I had two surgeries for the fistula. And the first one, he puts what's called a seton in, which I think was a good move because that's a very unobtrusive approach and the least invasive approach. And they do something they call a fistulotomy where they'll remove the fistula, but my fistula was too close to my sphincter muscles. And so
Mm.
they could not do that. That was too dangerous to try to do that. And I remember when I went in for my second surgery, I had a belief that I had healed my fistula. And so I said to the surgeon before he operated on me, I said, what will you do if you find that my fistula is healed? And he said, it's not healed. He said, you're much worse. You have moderate to severe Crohn's disease with a fistula. It's very, very complicated. And you're going to have lots of surgeries, essentially, is what he told me.
What was he
And then
basing
he
that
did,
on? What did he
well,
base
the
that
fact that
that
he had, when he had looked at last inspected my uh,
when he did the first
body,
surgery?
well, no, when I went for the outpatient visit and I said I'm feeling good, and then my fistula had inflamed, he was basing it on the fact that he had seen that the fistula was inflamed
And
the last time he saw me.
how long prior was that to when you actually had the second surgery? Like, what was the time gap between when he'd seen
Maybe
the
a
diagnosis?
month or two. It wasn't that long, I don't think.
And it's really interesting because I do find that somehow in a month or two, they don't expect that there could be progress, or they don't expect something to have changed. They can still base decisions 2 months later on a test that was done like a month and a half, before, without thinking that there could be a possibility for healing. So was there anything that you did differently from the first diagnosis, from that month, that appointment you had a month and a half ago, up to the point you had the surgery? Was there any other treatment? Did you change anything about diet? Or I think you mentioned homeopathy. So was there any other treatment involved before the surgery?
So I'm not exactly certain of when I started on a homeopathic remedy, but my naturopath, when I was telling him about the difficulties that I was having with the surgeon, he started researching fistulas, and he said, "I think I have an idea for a homeopathic remedy that might be able to help you. I think it's called Silesia. Does that sound right? Did I
Silica.
say that right?
Silica.
Silica. Yeah, yeah. So I'm
Yeah.
pretty sure that was what he ended up giving me. Um, and I was doing all kinds of things. Like I had a friend who's a empath, and
Mm.
he would work with me and instill. He would do this remotely, but he would actually put like um, essential oils. He would instill them, and he would work to do certain affirmations with me and such. And so I would every day I would like like have a certain affirmation about how I was healing my fistula,
Yeah.
um, and then I had another friend who did energy work on me. I had a friend who's a Christian who was praying to Jesus. I mean, there were so many different things that were
You're giving
happening.
everything you got, basically.
Everything, yeah. As long as I didn't think it was going to harm me, I was going to try it.
Yeah, of course.
Uh, yeah.
And out of those sort of, I guess it's hard to tell really, but that combination, was there one particular practice you felt was a strong driver in your belief that you had healed the fistula? Was any of those practices like quite dominant for you in terms of feeling, I think I've healed this?
Yeah, it's a good question. I don't have an answer necessarily. I'm pretty confident that the homeopathic remedy was useful for me and helpful. I take pulsatilla now too, which is sort of as a
Yeah,
constitutional remedy,
yeah,
and I
it's a
think
great
that's
remedy.
been very helpful too. Yeah.
And so when the surgeon obviously had told you it's terrible. After this surgery, you're probably going to be having several. What were the findings when you went into that surgery then?
So the interesting thing was that, not really interesting, it was disappointing. He told my wife that I had healed my fistula from the inside out and
Wow,
that no more surgery was needed. But he never told
asked
me
how,
directly. Well, not only did he not ask how, but he never acknowledged that he had been so arrogant and wrong. And because I mean, in my mind, he had caused me a lot of distress.
of course.
You know that, and then there was also like a I guess she was a nurse practitioner or a physician assistant who, well, she in particular, I left her office thinking, I can't believe I just paid her money for her to, try to put the fear of God in me. It was like, what a waste of money,
Yeah, and
and then
energy.
yeah, and I said, I'm never going to see that woman again. I don't ever want to see her again because I was so upset with her. I mean, she was well-meaning. I
Mm.
mean, I have to give people the benefit of a doubt and say, they're not. They really are well-meaning, but they're so. For me anyway, it was very harmful,
Yeah.
and I would
And
have
how?
loved for them. Go ahead, sorry.
No, no, sorry. Go ahead.
I was just gonna say I would have loved for the surgeon to say I'm sorry. I've never heard that.
Yeah, and that was actually my next question. Like, how important do you think in the healing process it is for the patient to feel heard, to have to have them speak about their body and be able to feel that they are being listened to and they are being respected and heard in terms of what they think may be happening, inside of them.
Well, that's the big difference between the working with the naturopath and the traditional practitioner. I mean, I felt heard and respected. It was almost like we were on this journey together.
Yeah.
Like I would research. Like I had a friend who had breast cancer, and she mentioned to me that she took something called amla powder that
Hmm.
she was told is a very powerful antioxidant. So I added that to my diet, and so I was doing some things, and the naturopath was doing some things, but we were engaged with one another. We were on this
Yeah, and would
journey
you say
together, in this journey together.
Yeah, and would you say with your naturopath, you felt that you had the ability to suggest other things in addition to what the naturopath might be suggesting, and still feel considered and heard, not just dismissed and sort of told, no, that that's not the right thing to do.
Absolutely, 100%. That's exactly it. It's a very different model. He's not on high, and he's not superior. We're really
Exactly.
equals.
Yeah,
It's a
and I
lovely
think
feeling.
it's so, I mean, that's what I find so beautiful about sort of holistic or naturopathic healing is that the patient, the patient, I don't even want to call them the patient, but the person is in charge of their health. No one can understand their body better than they can. No one can say what is working or isn't working better than they can. And as a healer, you're here to guide that person, give suggestions based on your experience and your understanding. But if that person turns around and says, I don't think this is the right thing for me, or I'm not feeling so good on this thing, but this other thing is really helping me, then it's about empowering that person to feel that it's good for them to speak up and make those decisions. It's not the practitioner's responsibility to make the decisions on behalf of the person, because it's their health at the end of the day, and they should be in charge of making the decisions about their health. So yeah, I do find that model so empowering, and I'm so grateful that you had such a good, it sounds like an amazing naturopath near you and accessible to you, and that he supported you as well as he did through your situation. And I guess there's always that, we can always have that feeling of the people that didn't listen to us, the people that didn't hear us, like the surgeon who didn't admit or at least acknowledge that, yes, you had actually healed it, and not even be interested to know how you'd done that, despite him having told you that the diagnosis was so different. So what would you say to people who are quite scared, as I have been and you have been, in a situation where you're told that this is the only way, and if you don't, the only option is going to be something worse than where you are at the moment? How would you advise someone sort of go about the thought process of evaluating the options more evenly than what you're made to feel when you go to see a medical practitioner?
So I think some people find comfort in having an expert who can say, this is what you need to do, and they're going to follow that.
Yeah.
But it's not at all an empowering experience. And so I think I would encourage people before they leap to just, they talk about getting a second medical opinion. It's the same idea, really.
Yeah.
And so I didn't dismiss the idea of this very lethal drug, but I thought there's no way in the world I'm going to start there. And I couldn't understand why they were recommending that as a starting point. To me, that was
Mm.
like the absolute last resort. If everything I tried failed, then I had to be open to that possibility. So I would encourage people, if they have the time or feel like they can make the time, to explore alternatives and to find a naturopath who could really help them on their healing journey, I believe. And I think it's well worth the time and the little bit of money. Uh, and it's such a wonderful feeling to feel like you're in control of your health and your body.
Yeah.
And I mean, there's something, I know that there's some, uh, what's the word? Some people find comfort in the idea that, oh, I can take this magic pill and it's going to help me, but it's not really, it's a false
Notion. Yeah.
notion.
I
Yeah.
mean, like, it's only a magic pill if it solves all the problems and you will not have any further problems. If it's going to cause something even worse than what you have, it's not really a magic pill. It may be a temporary solution, but it's not going to be the long term sort of health or vitality that you're after. And I think sometimes it's hard to it's hard to remind people of that, because you're thinking about the situation you're in right now. You're in a lot of pain right now. You want that thing gone right now. And it's always about that, we live in that instantaneous world where it's like, what's the quick fix? What's the thing I can take today that's going to just stop this and make it go away? And while yes, you can go down that route, of course, it's about thinking, but do you want to be back here? Do you want to come back here, or do you want to make sure that you never ever end up in that place again? So it's about weighing up those two options: sort of quick fix and you may be back or worse, or it's, I want to heal myself inside out, like you say, completely inside out. And so, although the surgeon didn't tell you the news, how did you feel when you heard the news that you had healed that fistula inside
Oh
out?
my God, I was so ecstatic and relieved. And then I felt like Superman. It was just like, this is incredible. I just did
Yeah,
this. It felt so wonderful
it was
and
you,
such a
you, and
great
you.
relief. Yeah, it
Yeah.
was really an amazing feeling.
And so, no surgery since, and you said it's been a year and a half. Is that right?
Yes.
And how are you sort of how are you feeling? Like, do you have concerns or worries about health in general? Do you worry something may come back, or do you feel quite in control of the situation now?
So I have some apprehension because, like when I go to a traditional medical doctor, they're all very skeptical still. And they all tell me the only way you're going to know for sure that you have overcome Crohn's is to have another colonoscopy.
Mm.
And so in November, I'm going to have, like, there'll be 3 years in November, and I'll have a follow up colonoscopy. The Either the physician assistant or the nurse practitioner had wanted me to do that right away because she wanted to disprove that I was as healthy as I thought I was. And I
Yeah.
discussed it with the naturopath, and I said, I'm going to wait. So I mean, I have markers that tell me that my inflammation is gone. Like I was anemic when I first was diagnosed with Crohn's. I'm no longer anemic.
Wow.
I always, for years, I always had a slightly elevated white blood cell count and didn't know why. And I'd get an annual blood work, and my white blood cell was always slightly elevated. It's no longer elevated. The I do something called I check my SED rate, which is supposed to be a marker for inflammation, and it's normal. So everything that I know to do tells me that I'm
You're okay.
fine.
Yeah.
Yeah,
Or
but
more
I
than
think
okay. You're healthy.
yeah, yeah, but having that colonoscopy will be the definitive proof, I guess.
And I guess it will put them to rest so that they're not so skeptical when you go to see them, or they're not, they're not trying to tell you that something's wrong with you when something's not wrong with you.
Right,
I
right.
think it's just been fascinating to sort of like go through that process and with you and just understand the sort of healing behind it, because I guess it takes a certain amount of courage to actually say, do you know what, I'm going to take this into my own hands, and I'm going to just do my research, and I'm going to see what I can find before I accept that the way you're telling me is the only way that I might get better. Because we're brought up to believe that the people in the white coats are the experts, the people who've spent 6 years or 8 years in medical school. They know what they're talking about, and surely if they've seen hundreds of these and they don't see a better way, there can't be a better way. um and I guess even though it takes courage to make that decision, you would have always had a level of apprehension and worry, which is why you tried as many things as you did, because you wanted to give it all that you've got. If someone is apprehensive, say they in their gut they know there's a better way, but they're feeling this level of apprehension. What if it doesn't work? It's going to cost me this much. What if nothing happens once I try it? Um, is there something simple you think people can do, like as a starting point, that isn't going to be expensive, that isn't going to be it isn't going to be too far away from what they may be used to, but it's still going to allow them to start feeling like small improvements? Is there like one small like the affirmations that you mentioned, is there something they can start to do, which is like a small step towards the right direction, I guess, is my question.
So at least in my instance, before I committed to spending any money with the naturopath, he did a phone consultation for free with me,
Yeah.
and I'm guessing that that's fairly routine and standard. So I think that's a wonderful first step. Before you leap, you just talk to this person and see if it makes
See if there's any
sense.
hope. Yeah.
Yeah, and I mean that was I mean I was confident after I had that phone consultation that this was a good move, and then I was ecstatic after my first visit. Um, at the same time, you've got family and friends who are afraid, and you've got traditional medical people telling you that you're making a horrible mistake. So it's difficult to weigh those. But the part of me knew that the idea of using a natural healing model and was the way to go. That was much more in control of my health by doing that.
Yeah,
But
I
at the
think
same
that's
time, it was difficult. Go
yeah,
ahead.
it definitely is. It definitely is hard, especially when you're going against what you've always known. It's the only thing you've known, and then try, almost finding an alternative route can seem quite scary. But I think that's fantastic advice. A lot of health practitioners do give you that first initial consultation or quick phone call for free. So even just speaking to someone to say, like, this is my situation. Is there any hope? Is there something you can recommend? Is always a great first step. And I find that natural practitioners are always just so open and so wanting to help, that even if you don't end up working with them, they'll give you as much advice and they'll give you as much of their knowledge as they can, because they want you to experience what natural healing can do for your body. So that's brilliant advice. And Sam, I think I'd now like to move on to your you've got a fascinating project that you're working on, Love Serves All, I believe. It's called, could you tell us a little bit about that?
So there's two things that I'm doing now. That one, I have a blog and a podcast that I call Love All, Serve All. And it's really stories of appreciation of family members, people, friends, various loved ones that I just have in some way impacted me in a positive way and touched my life. And the other thing that I'm doing, working on right now, I had a background working with people with developmental disabilities, and I'm in a position where I'm going to set up a loan fund to encourage people with developmental disabilities to start their own businesses.
Wow.
And I'm real excited about that. And I'm 66 years old now, so it's kind of I'm thinking about sort of my legacy in some way, I guess.
Yeah. Yeah. That's beautiful. And like how soon will that be up in terms of the support for people to set up their businesses? That's fascinating.
Probably in the next maybe week or so, I'm going to put some money in the.
Wow.
I have a self-help credit union that I'm working with that is allowing me to do that, where it'll be a secured uh, loan for somebody. Will be low interest, and the money that I put into the bank will enable someone to uh, borrow money to buy something for their business.
Well, so amazing that you got your health back, because it leads to such valuable projects that you're now working on, which I think is just fantastic. And one of the things that gives me the most happiness when I hear people's healing stories, it's what they go on to do next after they've got their health back, and the amazing things they're able to contribute to and the impact they're able to make in the world. So I wish you the best of luck with that project, and please keep me updated, because I'd love to hear how that's going, and and just how much you do. And we'll also link your podcast and your blog to this episode, so anyone that's interested to hear more from Iron can have a listen and hear those stories, because I'm sure a big part of our healing journey is the gratitude, and tuning in to feeling the gratitude for the things that are going well, that are positive, and having ourselves sort of bathe in those stories that really give us those amazing feelings of positivity and gratitude. So thank you so much for sharing your story, and thank you so much for sharing your voice, and thank you so much for giving people hope. I'm sure there's lots of people who will be listening to this episode and will get a great amount of hope, because Crohn's disease is on the up, and a lot of people don't know they even suffer from it. Just as you mentioned, people can be quite ignorant to it. Because you may have just very simple symptoms like diarrhea, or you may just believe your body's just not metabolizing like it used to, and without realizing that there is inflammation and actually a chronic problem behind what's there. What sort of symptoms would you just for us to sort of end and give awareness to this issue in particular that you've talked about today, what sort of symptoms would you urge people to look out for and encourage them to go and get tested, for if they're experiencing? Because I think there's a lot of people that don't actually realize that this is what they are suffering from, or may be suffering from.
So I'd say there's two markers. I would say one would be sort of an urgency to go to the bathroom, and the
Mm.
other would be a frequency of going to the bathroom. Those are the two things I think I would pay attention to if that was happening.
Thank you. That's so useful. Is there any last sort of parting note that you'd like to leave the audience with before we end the podcast today?
So we mentioned gratitude, and I just want to thank you for this time this morning, and for the work that you do.
It's totally my pleasure. And it's just wonderful to bring these stories to the world. I want people to know that there is hope, and I want people to know that your diagnosis doesn't have to be the final way, or the only way. People can only speak from their experiences. So the more experiences we share that are varied and natural and holistic, the more options I feel that people will see they have in the world as well. So thank you so much. I hope wishing you all the best with your future project, and I'm sure we'll be connecting again very soon.
Thank you again.
Take care. Thank you so much for listening to today's episode. If you would like any of the links or the show notes, you can follow them in the description below. And for more episodes of the Back to Health podcast, please be sure to follow us on YouTube, or you can follow us on Spreaker, where we host our podcast. Thanks again, and I look forward to joining you for another episode of the Back to Health podcast. Until then, stay healthy, stay happy, and stay informed.